The psychology behind Alzheimer's disease. Before I begin to talk about Alzheimer's disease, it is important that we understand what psychology is. Psychology is the science of the human mind and its mental phenomena and processes. How does our brain affect our emotions, perception, intelligence, and consciousness? We will be specifically looking at what parts of the brain Alzheimer's disease affects, and how this leads to changes in an individual's ability to sense and perceive, learn, memorize things, socialize with others, and retain attention. So, what exactly is Alzheimer's disease? It is a progressive neurocognitive disease that gradually erodes parts of the brain pertaining to language, judgment, memory, cognition, and learning, and will eventually impact the individual's ability to function. This disease normally targets people in the age bracket of 60 years plus. However, the risk of developing Alzheimer's disease increases with age. 50% of people 85 years and older will develop this disease. Now let's talk about the brain. The brain is the most complex organ in the human body and consists of 10 to the power of 10 neurons, which are used to transmit information to different parts of the brain. The brain is divided into the cerebellum, occipital lobe, parietal lobe, temporal lobe, and frontal lobe. The beginning stages of Alzheimer's disease starts in the medial temporal lobe, specifically within the hippocampus. The hippocampus is associated with memory and spatial navigation. This means that in the early stages of Alzheimer's disease, mild cognitive impairment begins, causing short-term memory loss. The individual will show symptoms of forgetting words, forgetting names, misplacing common objects, having difficulty concentrating, and having problems remembering recent events. An individual can be in this stage for around 7 years before progressing to the mild early stage. The mild early stage is where the disease spreads to the lateral temporal lobe and parietal lobe. The lateral temporal lobe deals with the understanding languages, memory, hearing, and sequences and organization, while the parietal lobe oversees interpreting language and words, sensing touch, pain, temperature, and other touch senses, interpreting signals from vision, hearing, motor, sensory, and memory, and spatial and visual perception. In this stage, the individual will find their episodic memory, or the memory of autobiographical events, followed by semantic memory, which is the memory of the meaning of words, and finally procedural meaning to go. Alzheimer's disease will make it difficult to form thoughts and may result in the individual asking the same questions over and over again. The individual may also have difficulty completing their daily activities, such as performing tasks in social or working settings. Problems with reading, recognizing objects, remembering the names of new acquaintances, and the sense of direction will also be noticeable. The individual may also express feelings of frustration, anger, and other moods not characteristic to them. A person can be in this stage for up to 2 years before progressing to the next stage. In the final stage of Alzheimer's disease, also known as the severe late stage, the disease spreads to the occipital lobe, which is in charge of interpreting vision, color, light, and movement. During this stage, the individual may experience confusion or unawareness of their environment, major changes to their personality, an inability to remember personal history, loss of bowel and bladder control, and eventually will lose their ability to respond to environmental cues, as well as their ability to swallow. At this point, the individual's ability to fight off infections has also weakened greatly, making them highly susceptible to pneumonia. A person who has reached this stage of Alzheimer's disease will need around-the-clock care, as they will not be able to perform tasks such as bathing, eating, and changing clothes. They will also not be able to walk or communicate, which will prohibit them from being able to express if they are feeling ill or are hurting. Sadly, there are no cures for Alzheimer's disease, so understanding the psychology behind it and how to improve the quality of life for a person with this disease is the best form of treatment.